We are seeing a surge in cases in PNG, and just yesterday, 74 new cases were reported in Port Moresby and more around the rest of the country. This has come as somewhat out of the blue, but certainly was expected. We'd had a January with only 5 cases reported in Port Moresby. February, we saw the signs of an increase in cases with 124 cases reported. By about the 4th day of March this year, we've seen more cases reported in those 4 days than for the whole of February and January combined.
And Matt, does it tell the whole story? I mean, the testing hasn't necessarily been up to standard. Do you feel that the numbers could be a lot higher and the spread could be happening without people even realising?
Bev, the general impression that we have is that testing is relatively low here. We're looking at around 50,000 or so tests that have been conducted since the beginning of this pandemic. Of that, St John Ambulance has completed around 2,000 of those tests here in Port Moresby. Testing is low. Cases are higher than what we're seeing. There's a number of factors involved in that, and we think that there's testing hesitancy amongst people due to the stigma. There's also been challenges in accessing testing, at least more so in the last 2 months. It's been quite difficult to get a test through the public system. Given
this, how is the health system actually coping?
Port Moresby has one national referral hospital, and that hospital has 16 beds for COVID patients. Of those 16 beds, 6 are capable to handle ventilated patients. Port Moresby's opened a overflow hospital in a sports stadium that has the capacity of 43 patients. Yesterday, it had over 30 of those beds taken. I'm told that by tomorrow morning, they may all be full. So St John at the moment is working with the pandemic controller and the National Capital District to explore opening a overflow COVID care centre at the stadium that's next door to our headquarters. That stadium will be established as for low acuity patients that we can provide monitoring to, especially those patients that are high risk but are currently mild. They need nursing and some medical oversight. So St John is looking at this stage, evaluating our capability to partner with the Port Moresby Health Authority to rapidly set up and open that centre. And Papua New Guinea is putting a call out now for foreign medical assistance from our neighbours in the region. The Prime Minister, I'm told, the Health Minister today and the Pandemic Controller have sought from Australia assistance as a rather urgent situation because of fears that the health system here just will not be able to survive much longer if the trend that we're seeing at the moment continues.
I've also heard reports that there's no way to, say, isolate mothers in maternity wards so that many of them are contracting the virus. Is that true?
What we're seeing is people presenting for routine or emergency obstetric care, and unfortunately they're being coming in with COVID-19, so from the community. And what that suggests to us is that just how widespread this is. And in many of these cases, mothers may be asymptomatic or they may have symptoms. And that's posing a challenge for Port Moresby General Hospital and the other obstetric providers around the country, because health workers, naturally being helpful, are being exposed to the virus while doing their jobs. And so we're seeing places like Port Moresby General where we've had 40 cases reported as of yesterday amongst healthcare workers. And that leaves an already resource-challenged staff system at a real problem.
Are people abiding by the restrictions? There are some fairly severe restrictions in place.
Look, quite early on, restrictions were put in place back in March 2020. We've had many shopping centres in Port Moresby that have been very good at complying with the requirements. You go to buy your groceries, and you will have you'll be required to wear a mask. You'll have your temperature taken. These are all important, but around the rest of the country, as we travelled around, that was less enforced, and there was a sentiment amongst people that perhaps we hadn't had the spikes that other countries had had. So I think a degree of complacency, and understandably a degree of complacency, crept in amongst all people in society and had become relatively complacent. And so, that now people are very quick. I walk around my office, we're a healthcare organisation, and everyone's generally wearing a mask. And we're seeing more of that across the board now.
And do you think the vaccine, which has now been approved, the AstraZeneca vaccine under the COVAX, WHO COVAX plan, is that going to make a big difference, do you think?
I think it's about the timeliness of rolling that out. Right now, we're seeing a surge in cases, and there is serious concern that that surge will continue. The forecasting has seen around 800 cases by the end of this month in Port Moresby alone. That might not seem like a large number in other health systems, but in this one, that has the potential for a catastrophe. And we're already seeing government departments needing to close their doors. Essential services like the Department of Finance and the National Capital District have today reported cases, and that's resulting in a lot of concern. The vaccine being 4 weeks away, planning is still in process for how that vaccine is going to be rolled out here. And we haven't seen a high level of actualization of those plans and really tangible idea of who is going to be giving those vaccines. We know that the priority is going to be health workers, and we know that the priority is going to be what they've said is about 3% of the population who are frontline workers or essential services. And so we're expecting to see that be the case, but there needs to be some real assistance and a higher level of planning put in place around the role.
Matt, great to talk to you. Thank you so much for your time.
Thank you very much for having me on the program, Bev.